Good morning, everyone. What is Philly doing with another chimp mask on? I thought they got rid of the chimp masks here. Well, guys, excuse me. I am up here this morning at the Medical City Clark, up here on Clark. I'm just gonna walk and talk. I'm up here to make an appointment. You guys know I went back to the States. Pull that down. You guys know I went back to the States for my medical issue and you know, the hassle and the runaround I got on that. So I'm up here right now. I was asking around for a couple weeks now about doctors, which doctor to see. Here's where they did the antigen test and your test when they were testing for the COVID. They did it all through here. I've been asking around, which doctor's a good doctor? Who do I go see? That's the emergency room back in there. Because I didn't want to go to see 20 different doctors and they, you know, all of them run me here, run me there. But one name kept popping up. One doctor's name kept popping up amongst everybody I was talking to. So I'm going to come up here, see about getting an appointment with the doctor. Also, another name was given to me of a woman who handles all the benefits. In other words, insurances that are accepted here and stuff. So I'm going to go see her, talk to her about, you know, my benefits and what's covered, what's not covered. So that's what I'm doing up here. Masks are required here in the hospital area. As far as what's going on there. Oh, it's a bank. Morning. It's a bank. Masks are required. It's just one of the places that they do require it. No big deal. Then I'm going to walk over here. That's TRT. I was over there a while ago. I'm just going to go over there and check it out again, see what's open, show you guys around. So yeah, that's what I'm doing this morning. I know people were asking, you know, what's going on with your medical, what's going on with medical. So that's what's going on. This is the front of the hospital right here. They have a parking lot, but it's always full. You can never find parking in here. So they do have parking around the back end. So that's where I always park. So let's head in there and see if I can get something accomplished. Remember, never set out to do multiple tasks in the Philippines or you can be disappointed. One task at a time. Medical City, where patients are partners. All right, let's get across the street here. So I spoke to the woman in there, one that handles international benefits. Very nice lady, very friendly lady, very knowledgeable lady. It wasn't the one that someone recommended me to. That woman, it was her day off. But this woman knew what she was talking about. Yes, my insurance, Blue Cross Blue Shield, does cover me in the Medical City. It does not cover a doctor's visit. When I go in, say speak to a doctor, it does not cover me. That comes out of my pocket, but you're looking at 20 bucks maybe, something like that. Where's the sun at? Maybe 20 bucks. Procedures like MRIs, CAT scans, different things like that. She said they submit it to the Blue Cross. She said they're really good at getting back to you. Usually within 24 hours, they'll get back to the hospital. And they could pay 100% or a percentage of the procedure you're getting done. But still, the procedures here, to get things done here, it's cheap. It's not very expensive. If I'm admitted into the hospital, she said, yes, they pay it. She said, if you're an outpatient also, maybe you're getting something done, they also pay it. It's just a matter of submitting it to Blue Cross and them saying how much they're going to pay or what they're not going to pay, and what your responsibility is. But yes, I am covered here. That's a good thing. Good thing to know. I forgot to ask about the other doctor. Anyways, we're gonna head over here. I'm gonna show you this area over here. Show you what's in here. Task us on that building. They're just building them here. They're just building them, and the last time I was here, years ago, they were still building them. All right, let's head on over here. I did shoot back in the hospital. Didn't get an appointment with the doctor that I want to see. She comes in, like a lot of them, only a few times during the week. They do other hospitals on other days. She's in there Tuesdays, Thursdays. I didn't make an appointment for Thursday. Thanksgiving's Thursday. We have plans that day. I got the secretary's number. She told me to contact her, send her a message next week when I want to schedule an appointment, because she said sometimes they may be in, they may not be in, we don't know. So there we go. That's all set up. That's ready to go. Accomplished that mission this morning. We could cut across here. Then we'll show you what's up here in this area. All right, we got a Starbucks here for your pleasuring, for your service. Morning. 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 Good morning. That's what's nice. You can come here. So you got an appointment over at the hospital and you got to wait a while. You can always come over here instead of hanging out in the hospital, and grab yourself something at Starbucks. It's really nice. Really nice landscaped. Really nice. It's kept nice. It's not kept trash looking, but you can see over there more buildings are going up. It's developing in here. A lot of development going on in here. It's been going on for quite a few years now. This area here was one of the first areas that was developed. Got little, let's see what's up here. Don't know how big of a hit this area took during COVID. Good morning. You got a Family Mart right here, like a little grocery store. This here is appears to be a restaurant. Cat's Special. Dining Special. Says there, a sign says open. Lights are on. List all their specials out here. Morning. Lugal Boss. Down here's your ATM machines. Temporary out of service. Walk down through here. Walk around here. See what's over here. Hometown Flavors. For the restaurant here. Menu. All right, let's head upstairs. All right, guys. So the girl at the security there, she told me I'm not allowed up on the next floor because it's all call centers up there now. In the past, you could go up there and there are restaurants up there and you can, you know, check it out up there. But she said now it's all call centers. So if you are not a call center person working there, you're not allowed up there, which, gotta understand that. I understand that completely. But yeah, it's changed. There also used to be, she told me, a restaurant on the rooftop. And I asked her what happened to that. She said, bankrupt. But yeah, all call centers, floors of call centers, floors of call centers, more floors of call centers. Now, whether all the floors are used up, I couldn't tell you. She didn't know. She told me these are being built with the anticipation of businesses moving in. I don't know. I don't know if I'd invest my money into building something with the anticipation of a business moving in. Guys, there are a lot of call centers here in this area, on Clark, Angeles City area. Tons of call centers. You get a lot of girls and guys from all over the Philippines will come to this area for jobs in the call center. I don't know how much they get paid. I don't know if they have benefits. I don't know. I should ask one of them one of these days. But that's what they say. Angeles City is just a mix and match of people from all over the Philippines, for that simple reason. People just coming here to get jobs. In Clark, in the city. Well, you know what? I'll go right down here. I see a bunch of people sitting, and I'll ask them. Oh, I know why they're sitting there. It's the puff, puff, puff area. Now let me go over there and I'll ask one of them what their pay is, if they'll tell me. All right, so I just got done speaking to the friendly staff of the call centers here, and asked them. They have a company they work for, and the company handles multiple like credit card companies and just different services throughout the United States. So when you call your credit card company or another company that you're dealing with, you know the deal. I can't understand what they're saying. Speak English. Well, they are speaking English. It's just you can't understand the Filipinos say accent when it comes to speaking the English of America. I asked them, yeah, people like get mad and hang up on you and scream at you. They say, yeah. Very nice, very friendly. I asked them, I didn't come out and ask them, how much do you make an hour? You know, you don't want to ask like, I would say, you probably make between 0 pesos and 1,000 pesos a day. And they say, yeah, you could say it like that. 1,000 pesos, 20 bucks a day. This place here is manned 7 days a week, 24 hours a day. First shift, third shift. They're coming off a third shift. I think they said they end at 10. I asked them if they have benefits. You have health insurance benefits and, you know, benefits like that. And they said, yes, they have it. They said they take good care of their employees, and they're young. These were all younger people that I was speaking with, under 20 years old, or no, over 20, under 30, easily under 30. Now I don't know if upper management may be a little older, and they all were happy. They all seemed happy to have a job. Asked them if they're from around this area. They said no. They said they come here from the province. I asked them if they have to have an education, in other words, a college education. And they said yes, they have to have a college education. And that's the thing here. You need a college education. If you think I'm kidding, I'm not. You need a college education to work at a McDonald's here, to work in a mall here. It's required. Back in the States, we go in and you're going to see a lot of senior citizens at Walmart working. Not here. You won't see it. It's all a young workforce here. You're not going to see older people. You're just not going to see it. But they were happy. They were happy to have a job. They were happy to get paid, and good for them. You know, good for them. You know, the young workforce here. I mean, you go, unless you go into like a hospital, you're going to have older staff in there. You go into a bank, you're going to have older staff in there. But the average job, like a call center, young clientele, or young workers. Where do I got to cross? There we go here. Let me cross here. That'll take you down to the traffic light. You turn left, it takes you up on, it'll take you in a route up to the highway that shoots you down to Subic Bay, Barrio Barreto. Look at all these trucks over there out in the distance. That's all, that parking lot was never like that before. It's full. So, anyways, there it is. In the hospital. Like I said, I needed to get this started. Some people might say, well, why'd you wait so long? I was handling the car. Getting that handled and taken care of. That's finally done. Picked up the car. When was it? Saturday. Picked up the car Saturday. Everything is perfect. Everything is good. They did an amazing job. I wanted to see if I could film around here and kind of show you what a Toyota dealer looks like when it comes to like their maintenance area and their spray paint area. But the guy I usually deal with, he was not in. So but everything is good. Everything is good. It took me some time just to get that car situated. So anyways, here we are again. I'm gonna wrap this up. Like I said, this area here was where they would do all your paperwork for your antigen tests, your PCR, TTR, MSR, BBC, you name it, that you had to get taken care of. There's swab area up here is where they used to do it. Done. It's all done. No longer needed, no longer required anymore. So this area is quiet now. And like I said, straight ahead is your emergency room. So all right, guys, from the Medical City Clark, I'm going to end this vlog, and we'll talk to you later.